Warning signs of labor. During labor, a woman can face many problems. If identified early, we can save both the mother and the baby. Remember, you are an angel for them during the labor. This video will highlight major warning signs that can be seen during the labor. The first and the foremost warning sign is headache. Headache probably due to the increased blood pressure. Remember, we all know normal BP is 120 by 80 mmHg. So the diastolic pressure is 80 mmHg. When this diastolic pressure increases from 80 to 100 mmHg, patient may have convulsions. You call it as seizures or fits. The next warning sign is fever. Intrapartum fever. Fever during the labor is a real and potentially devastating problem. It can be due to infection or non-infectious etiology. Infants delivered at the term who had been exposed to the mother having a fever during the labor had a 9-fold increased risk of cerebral palsy. The next warning sign is blurred vision. There may be edema. Edema means fluid accumulation in conditions such as preeclampsia. When the fluid accumulates in the eyes, it can increase the pressure in the eyeball and makes the cornea thicker, resulting in the blurry vision. The next warning sign is breathing difficulty at rest. This may be pathological. It also can be due to the exhaustion during the labor. Blood pressure more than 160 by 90 mmHg. This is related to the pregnancy-induced hypertension. Remember again, diastolic pressure matters a lot. If it shoots up to 100 mmHg, patient may have convulsions. Increased pulse rate and the decreased BP. This indicates bleeding internally. Convulsions, seizures, or you call it as fits. Mostly it is due to increased blood pressure. But electrolyte imbalance, particularly calcium, causes tetany in the form of tremors. Remember, even very low sugar, that is 30 mg per deciliter, can also lead to the convulsions. You need to identify the cause. The next warning sign is presence of Bandl's ring. See, this image shows a normal shape of the abdomen. The Bandl's ring is a pathological uterine ring. See, this is the pathological uterine ring. Okay. Is a constriction between the woman's thickened upper contractile uterine segment and the thinned lower uterine segment during the childbirth. Means a ring is formed between the upper uterine segment and the lower uterine segment, especially during the childbirth. This indicates the obstructed labor. So we can't proceed for the normal vaginal labor. It has to be reported to the higher authorities. Here, the uterine muscles creates a band in between the baby's head or a shoulders, remains trapped, leading to inability to deliver the infant through the uterine incision. These constrictions may result in severe trauma to the infant's head, neck, or shoulders, leading to delayed developmental milestones and cerebral palsy. Fetal movements, if it is going to be reduced or absent, reduced in sense if it is going to be less than 10 per 12 hours, or the fetal movements if it is going to be accelerated means it is more than the routine, is going to be a danger sign. So what is the normal fetal movements according to the daily fetal movement count? Let me know what is the normal fetal movement is. 3 counts each of 1 hour duration. For example, morning 1 hour, noon 1 hour and evening 1 hour. So we have to advise the patient to count each 1 hour, and every hour, whether it is going to be the morning, afternoon or evening, every 1 hour should have at least 3 movements and it should be felt by the mother. If it is going to be less than 10 in 12 hours, or if it is going to be less than 3 in 1 hour, it means there is a fetal compromise. The next warning sign is increased FHR, that is more than 60 beats per minute, or decreased FHR, that is less than 110 beats per minute. Normal FHR ranges between 110 to 160 beats per minute. If it is above 160 beats or below 110 beats per minute, is called as a non-reassuring FHR. So the term fetal distress is being replaced by the non-reassuring FHR. Abnormal uterine contraction. This is the normal uterine contraction ring. It starts from here. Where does it start? It starts from the corner of the fallopian tube ostium and it spreads down. So before that, let me look at the key. From bottom it says it's weak in color and it grows darker, and that is strong at the top. So the contraction starts from the tubal ostium and contraction starts spreading it from upper to the lower uterine segments. The height of the contraction increases. Again, the contraction starts fading down. It comes down. But the uterus gets retracted. Finally, when the uterus gets retracted, means the uterus pushes the baby out of the womb, but still the uterus becomes smaller. Okay, so this is the normal uterine contractions with single dominant pacemaker focus. So what does this pacemaker stands for? Usually, uterine contraction starts spontaneously. Hence, they are called as the pacemakers of the uterine contractions. That's what I said to you. It starts from the tubal ostium, that is fallopian tube ostium. It starts from there and it spreads down towards the lower uterine segment. Note that dark shade indicating the strong contractions. And this is the abnormal uterine contractions. Uterus with the 3 separate pacemakers firing sequentially. And this is normal uterine contraction because it starts from the fundus only. And this is uterine inertia. What does this uterine inertia means? It is a failure of the uterus to expel the fetus normally. Means there will be an irregular pain. The pain would have started and it would have discontinued. That is called as a uterine inertia. And this shows a colicky uterus. What does mean by colicky? Colicky means a severe pain in the abdomen. This is spastic lower segment. Spastic means it is a muscle spasm only. This asymmetrical contractions. Look at the dark colored. Okay, it's one side and it's just opposite. So it is asymmetrical, it's not equal. Okay, the polarity is not good. Finally, this is a cervical dystocia. What do you mean by this cervical dystocia is? It is the external os, means the cervical os. The external cervical os fails to dilate in spite of the normal behavior of uterine contractions. Normally, the government of India says if there is a uterine contractions for 3 times for 10 minutes, so you call the labor pain has been started. So the maximum uterine contractions should be from 1 to 5. It's not more than that. And if it is going to be more than that, it is abnormal. The next warning sign is tearing abdominal pain with increased pulse rate or decreased blood pressure. As I told you previously, the increased pulse rate and the decreased blood pressure denotes internal bleeding. If there is going to be a rupture of uterus, there will be a pain. Fetal movements can be seen if the fetus is alive, and fetal parts also can be felt on the palpation. The only clue will be the pains. What the patient experiences is, if there is going to be the uterine contraction, the normal uterine contractions during the labor, so this pain will not interfere with that. Okay, it will be between the normal uterine contractions. So there we could identify this is a rupture of uterus and this is an obstetrical emergency. Severe vaginal bleeding. This is a scant amount, less than 1 inch stain per hour. This is a light amount, it is less than 4 inch stain per hour. Moderate amount, that is less than 6 inch stain per hour. Heavy amount, maximum stain per hour. The government of India says if the sanitary pad is going to get within 5 minutes wet, it means PPH, postpartum hemorrhage. The next warning sign is premature rupture of membranes. When the amniotic membrane ruptures after 37 weeks of pregnancy, but before the labor starts, it is termed as a premature rupture of membranes. This may be giving a chance for the infection. Next is meconium stained liquor. The fetal cord at the head is being compressed during the labor causes a vagally mediated gastrointestinal peristalsis. Peristalsis means it is a movement of the GI products. Okay, so this vagal mediated gastrointestinal peristalsis, what happens is it is the same reflex will be due to the heart rate increased or decreased, means like accelerated or decelerated. So when the heart rate increases or decreases, ultimately they have the same vagal mediated nerve activated and ultimately it leads to the gastrointestinal peristalsis. This may be why a lot of babies pass meconium as the head is compressed, because their heartbeat would have been increased or decreased during the last minutes of the birth. What's the problem with that is, meconium gives the amniotic fluid a greenish color. If meconium is swallowed, no much problems arise. But in case inhaled into the lungs, it causes a meconium aspiration syndrome. Since meconium is thick and sticky substance actually, it can cause problems for the baby inflating the lungs immediately after the birth. The occult or hidden prolapse. Can you see this? This is occult. It's somewhere here. Okay. The cord is compressed between the fetal presenting part and the pelvis. Okay. The pelvis means the cord is compressed between the fetal presenting part and the pelvis, but cannot be seen actually, but can be felt through the per vaginal examination. This is called as a occult or hidden prolapse. But if the cord cannot be seen but can be probably be felt by the pulsating mass during the vaginal examination, is called as a cord presentation. See, can you have a look at this one? So if you're going to have a PV, if a person is going to do a PV over there, so they can feel the pulse of the cord. So that is nothing but a cord presentation. Finally, This is a cord prolapse, complete cord prolapse. The cord can be protruding from the vagina. Can you have a look at this? See, it's out of the vagina. So this is called as a cord prolapse. The next warning sign is labor exceeds more than 12 hours. Risk for both the mother and the child, including the oxygen deprivation or permanent injury or trauma in the child and hemorrhaging in the mother and infection also in the mother. Let me know about the labor stages. What does this 12 hours indicate? Okay, labor stages is first stage, second stage, third stage in primigravida, and this is in the multigravida. The first stage involves 8 to 12 hours in the primigravida and 6 to 8 hours in the multigravida. The second stage is 2 hours, and in multigravida it is only half an hour, and the third stage is 30 minutes. Both it is 30 minutes. Totally in primigravida it is about 10 to 14 hours is the normal labor time expected. If it is going to exceed more than 12 hours, okay, it starts with 10 hours. 10 hours, the delivery has to get over. If it is going to go beyond that, so this is a danger sign. And in multigravida, it is only 6 to 8 hours. The labor starts from the labor pain to the delivery of the placenta. And this should be normally 10 to 14 hours. The next warning sign is placenta not expelled within 30 minutes after the childbirth. Due to the active management of the third stage of labor, normal third stage completes within 10 to 15 minutes. In case if the separation delays and you experience boggy uterus, means a spongy uterus on the palpation of the abdomen, it indicates attachment of the placenta to the myometrium or perimetrium. Usually, the placenta attaches to the endometrium only. That is why it is called as decidua. The pregnant uterus is called as decidua because the endometrium is the only one which is going to shed out. And placenta not expelled within 30 minutes after childbirth is called as retained placenta. Inverted uterus or uterine inversion. What does this inverted uterus means? It is uterus is turned inside out partially or completely. Can you have a look at this one? This is the first degree. There is a dimpling of the fundus. So the main thing is here it is the dimpling of the fundus. See, the fundus is going to be, it is inside out, right? Okay. A dimpling of the fundus which still remains above the level of the internal os. Okay. And this is second degree inversion. So here the fundus passes through the cervix but lies inside the vagina. The third degree is a complete one actually. The endometrium with or without the attached placenta is visible outside the vulva. To the cervix and the part of the vagina may also be involved in the process actually. And this is the fourth degree where all is out. You could see it with your eyes. It may occur before or after the placental separation. You should know the difference between the uterine prolapse and the uterine inversion. Remember, uterine prolapse is entirely different from the uterine inversion. Uterine prolapse is when the uterus descends down or into the vagina. It's total. The fundus is not going to turn over here. The fundus is whole over here, okay? No disturbance with the fundus at all. It happens when the pelvic floor muscles and the ligaments become weak and are no longer able to support the uterus. Diminished urine output 400 ml for 24 hours. This has to be ruled out. Whether she has a retention of urine or might be she's getting into dehydrations or bleeding somewhere. So this has to be ruled out. So urine output is must to measure it. The next one is turtle sign. What is this turtle sign is? Shoulder dystocia is when, after vaginal delivery of the head, the baby's anterior shoulder gets caught above the mother's pubic bone. This is what's shown in the figure. Can you see that? So this is a pubic bone, okay? And here the shoulder has got stuck. The signs include retraction of baby's head back into the vagina. So what happens during the labor? The head may come out, and it would have gone back also, just like a turtle which pulls the head back inside, right? This is called as a turtle sign. This means the mother has a shoulder dystocia, and this is a turtle sign, is a warning sign. Finally, let me wind up. Danger signs of the labor are fever, convulsions, blurred vision, blood pressure more than 160 by 90 mmHg, or premature rupture of membranes. Fetal movements, absence or reduced means less than 10 fetal movements per 12 hours, or fetal movements accelerated or more than the routine, a placenta not expelled with 30 minutes after the childbirth, or severe uterine contractions. Increased fetal heart rate, that is more than 60 beats per minute, or decreased fetal heart rate, that is less than 110 beats per minute, meconium stained liquor, uterus turned inside out, that is uterine inversion, and diminished urine output, that is 400 ml per 24 hours, and breathing difficulty at rest, or severe vaginal bleeding, abdominal pain or tearing sensation in the rupture of uterus, labor exceeds more than 12 hours, or literally it is called as prolonged labor, that is more than 14 hours. Know better, care better.